Hi everyone, Vikram here from PT Wired. Here are 3 tips to improve your patient retention. Tip number 1, set expectations for the patient. This sounds great, but what does this actually mean? Once the patient comes in for their initial eval, you should set expectations about what their course of care will look like after you understand their goals and what their actual injury or problem is that they're trying to improve. When you communicate an expected plan of care length, you set expectations for the patient so that they understand what progress looks like in a reasonable time frame. That way, if they're not hitting their goals at earlier stages that they would have originally thought, they're not going to feel as dejected, defeated, and end up dropping out. When you communicate an expected plan of care length, you can give them a general number of days. It would take normally 45 days to meet these goals that you told me with this injury, 90 days, 100, a year. It doesn't matter, and it can also change, but as long as the patient has a rough understanding of how long things will take, then they're much less likely to drop out if they encounter any difficulties or have setbacks. Another big part of this is to also give an expected number of sessions. You'll come in for 90 days to get this goal. That'll be the expected plan of care length, and we'll also want to see you about 10 times over that time period. That way the patient understands that in addition to just going through the plan of care and doing their exercises and all that, the regular visits to their physical therapist are very important so that they can make sure that they're optimizing their recovery. Also, talk about milestones, especially if the patient gives a very big goal that you know is going to take a lot of time to achieve. That way, you could break down that big goal into bite-sized milestones that the patient can achieve in earlier time frames. That way, the patient is getting progress that they can see and measure and understand that they had set out goals from the beginning for, even earlier than meeting their primary goals. Finally, you should address and manage setbacks from the very start. That means talking about what may happen and what setbacks may occur during the patient's journey. If a patient understands that certain things may be difficult, certain things may get worse before they get better, certain things just, may be very challenging and you may not see progress for a very long time, that way, once the patient has these setbacks, they're not going to feel as defeated, they're not going to feel as overwhelmed. They'll feel much more likely and much more prepared to stay in their course of care and stay committed to their rehab to meet their rehab goals. Number 2, look for indicators of dropout. This is a huge one. If you can understand what the actual indicators are of a potential patient dropout, then you'll be much more likely to be able to identify them and intervene before the dropout actually occurs. And then you can change things so that instead of the patient dropping out, you can offer them the support they need, the guidance they need to then keep that patient and get them to discharge rather than drop out. So what is the number one most likely reason that a patient will drop out? It's poor adherence to their home exercise program. If a patient isn't adhering to their home exercise program, then of course they're going to drop out. They're not going to be progressing, they're not going to be satisfied. And what does that tell us? That tells us that the exercises that they're being given and how they're being communicated aren't being received as important by the patient. If it was important, if it was something that was implemented and incorporated into their routine, then they would do them. So if they're not doing them, you need to identify that, you need to catch that, and you need to intervene to try and get them to change their behavior. How do we do this? First of all, you have to emphasize the importance of the home exercise program from the very beginning. You can say when you set expectations for an expected plan of care length and expected number of visits, this is the normal, this is the average for this type of injury and these types of goals, but it completely depends on if you adhere to the home exercise program. If you don't adhere to the home exercise program, we won't be able to get you to your goals because you won't be progressing at the rate that you should and would. Another important thing here is the mechanism approach. If you explain the mechanism behind the exercises, patients are much more likely to actually do them. Explain why the exercises are the ones that you're prescribing. Explain what they help the patient achieve and how that's linked to their rehab goals. You don't have to get too technical, you don't have to get too anatomical with the terms you use and all this, but if you give the patients a rough understanding of the purpose behind the exercises in language that they can understand, then they're much, much more likely to actually do their exercises. Another big piece here is accountability and progress tracking. If you can have some type of patient engagement software or home exercise program that allows you to track patient progress in between visits, the patients will be much more likely to actually do their exercises. Accountability is a huge piece of behavioral modification for home exercise programs. If you have something where you're able to track that patient's progress, then they're much more likely to actually change their behavior and stay committed because they have that extra support that they need, and also that extra push that they know that somebody's holding them accountable. They know that somebody's looking and seeing if they're actually as committed and as devoted to accomplishing their rehab goals as they originally said they were. Finally, a huge reason that patients don't adhere to their home exercise program is low levels of social support. This ties into accountability a bit, but a big piece that is the big problem here in the physical therapy space is that in between clinic visits, a lot of patients are just on their own. They don't have any connection to somebody who's supporting them, offering them feedback, offering them advice as they do their home exercise programs. The fix here is simple. Get a patient engagement software or a home exercise software that allows you to message with patients in between clinic visits. That way, if a patient has an issue, if a patient has a problem, they can get the question answered. You don't have to wait till the next visit. You don't have to wait till a week later for the patient to get their question answered. And that way you don't lose out on all that progress. Number 3, simplify the onboarding process and the scheduling process. Patients don't want to be filling out a ton of paper forms, especially ones that have the same information over and over on different forms. Get rid of those forms. Use something that's a digital platform for intake, which simplifies the process and makes it much easier for patients. For scheduling, 68% of patients say they want the ability to schedule on their phone. You need to find a way to ease the process for these patients who want a simplified appointment scheduling process. Use a software that allows them to book appointments online so they don't have to call into the clinic every single time they want an appointment. Especially if you can have that integrate with your home exercise program or patient engagement software so that as they're doing their exercise on a digital interface that's very interactive and engaging, they can also schedule their appointments in the same place. That's even better. Thanks again for watching. This is Vikram from PT Wired. We do branded mobile apps for physical therapy clinics, for patient engagement, home exercise programs, marketing, branding, and much more. If you're interested in exploring other patient engagement options that can help with a lot of the things I talked about in this video, just shoot me a message, reply to my email, vikram@ptwired.com, or go to www.ptwired.com. Thanks so much.